Well, it's very commonplace that I get patients that tell me that their doctor told them that their thyroid results were normal and there was no problem with thyroid. However, the patient was feeling all the symptoms of low thyroid. So they would come to me and ask me the question. And the answer is that the interpretation of the lab results of thyroid is very different when you look at it from the functional viewpoint as opposed to the mainstream doctor, because the actual active thyroid hormone is called T3. Usually the mainstream doctor would look at T4, which is the thyroxine hormone that is released from the thyroid gland. So usually what the doctor would do would be looking at the hormone called TSH, which is a thyroid stimulating hormone, and they will look at T4. And if your TSH was within the range, they will tell you everything is fine and go home. But when we look at the functional viewpoint and we look at how the patient is doing, the actual thing that's physiologically happening is that the T4 or thyroxine hormone gets converted into the active thyroid hormone called T3 in different parts of the body and also mainly in liver. And that is the hormone that actually creates the effect of the thyroid hormone, which is improving or increasing your metabolism, increasing your energy, increasing your body temperature, and making all the metabolic processes go faster. Even your brain, your thinkingness, your mental acuity improves when your thyroid is normal or optimal. We call it optimal thyroid activity, and it is measured by T3. It's actually not measured by T4 particularly, because you could have a lot of T4 in the body. But if it's not converting it to T3, which is the active thyroid hormone, then you will manifest all the symptoms of low thyroid disorder. So that's how I train my patients to actually realize what the scene is. The scene is they have a lot of T4, which is not being converted into free T3 peripherally in the body tissues. And so that's why they have the symptoms. And the other thing is the TSH. So the mainstream doctor would go by TSH. So if the TSH is below 4, then you're good. There's no problem with thyroid. However, what happens a lot of times is that the TSH sometimes have nothing to do with the T4 or T3. So in other words, there's a disconnect between the axis from the pituitary to the thyroid gland. So even if your TSH is normal, but your free T3 could be very low, and there is different scenarios. It could be a problem with the peripheral conversion, or it could be just that the T4 is not enough. But the TSH has been, by many scientific studies, has been shown to be not a reliable measure of the thyroid function of the body. It's actually unreliable, and the reason would be the disconnection from the thyroid TSH to the T4. So many times you will see patients who have all the classical symptoms of hypothyroidism, but their test per the mainstream doctor would be normal. So don't fall for that.